Good afternoon. I'm George Latimer, Westchester County Executive, and we're here for the second of our twice-weekly updates on the Westchester coronavirus infection spread here in Westchester County. I'm joined by Deputy County Executive Ken Jenkins, as I am each of these times. We give you the update, and we're going to give you a little bit of information about where we are with the spread of the infection, or the reduced spread of the infection, which is how the numbers are pointing out. Talk a little bit about vaccinations. And then our guest today, Mayor Brian Smith, is with us from the village of Irvington. And we very much enjoy having local officials join us here to give you an update of what's happening in their communities. We think it's important to make the connection between towns, villages, cities, and the county as a combination of local governments who try very hard to work together as partners. Mayor Smith will give you an idea of what's happening in his community. Lovely community, one of the Rivertown facilities, great restaurants, as I can point to myself. And we're very happy to have him with us here today. We'll bring him on in just a few seconds. To give you the latest numbers, the tracker from New York State is up today. So these are Thursday reported numbers on a basis of 128,236 Westchester County residents that over the course of the pandemic have at some point in time tested positive. Of that total, we have right now 1,742 individuals who are an active case of coronavirus. And that number is continuing to drop day by day, and we're very encouraged to see the dropping numbers. 1,742 is the number today. A week ago today, we were at 2,640, almost 1,000 cases more dropped in the last week. 2 weeks ago, we were at 3,714. So that's about 1,000 cases a week over the last 2 weeks. And if you go back 3 weeks ago, we were at 4,565. And as I referenced back, the most recent peak in January, we were at 11,500. So we're down now to 1,742. It's been a steady diminution. Just to give you an idea, out of 8,220 tests yesterday into today, 83 of them tested positive. So you can see that's a very small ratio, 83 positive out of 8,220 cases. And that percentage of infection is a drop from where we were months ago. We had much higher high single-digit numbers in terms of infections. The most recent hospitalization number we have goes back to Tuesday, where we had 115 people hospitalized. When we take that number compared from the prior week, we had 138. The week prior to that, 146. The week prior to that, 194. So we've had a steady diminution. If you want to go back about a month ago, we had 226 people hospitalized for COVID. That's not the same individuals. It's a net number. But to be at 115, where a month ago we were at 215, 216, is a good sign of progression. And our fatality numbers are always concerning us, but we lost no one over the last 24-hour period, which is the kind of number I'd like to report every single time I'm behind the microphone. We had a couple of days consecutively where we lost one person per day, and if you compare us to where we were a week ago, we've lost 6 individuals over the course of a week, 6 families impacted by coronavirus in a deeply tragic way, but 6 people is a much lower number than we've seen in prior weeks. If you go back 2 or 3 weeks, we're in the 20 range per week, and then, of course, back during the peak period of time, much higher than that. So we hope that in one of these reports I'll be able to tell you we've lost no one over the course of the last week. That would be the best possible number I could report as we see where we are. We're looking at the decrease of an infection that in all likelihood is based on the increase in vaccinations. And it's the increase in vaccinations that give these numbers some hope for the long term. If you followed the path of the virus from when it first hit us in March of 2020, we had a period where there was a diminution of cases and was flat during the summertime of last year and into the early part of the fall. But then the numbers started to rise, and we had no vaccination at that point in time. We had social distancing, contact tracing. We had limited public health tools to work with testing and so forth. Now that we have a vaccine, a number of different products, but we have vaccines that can help us stay separated from the disease, we have the hope that these numbers drop and they'll stay down over the course of time. We won't know until time passes whether we'll all need booster shots in the future, but for right now, in terms of where we are, we have some encouraging numbers. If you look at the population of Westchester County, we're over 500,000 people in Westchester that have had at least one vaccine dose, and we have 67% of the population that's 18 plus that has at least one dose. And it's important to note that because we've been giving general numbers out. We've vaccinated 40-some-odd% of all the population. or 51% have gotten one shot, 52% have gotten one shot, we didn't factor out that 20% of our population are young people under the age of 16 and have yet to become eligible to be vaccinated. So the real universe of who we could vaccinate were those that were 18 and over, and then a little bit later 16 and over. And within that cohort, we have vaccinated a significant portion, almost 2/3 of everybody in Westchester County that's over the age of 16 has been vaccinated. So that's a good sign, and that represents what we hope will be a way to make the spread continue to drop, because people will not be getting the disease. The vaccine will prevent them from contracting the disease. That's the hope in terms of what we're dealing with. Our numbers at the major vaccination centers continue to be rise and impressive. At the county center, which has been the anchor for our vaccinations within the county, opened back in January, open 7 days a week, open 11 hours a day. 239,148 vaccinations have been issued. That's a huge number in one facility. The Yonkers Armory, which has been open a lot less than that, is 56,855. And our two county-run clinics, one here in downtown White Plains and then one over at the county community college location, the gymnasium, 50,000, over 50,000. And we want to thank all of the people that have worked to make those vaccination numbers happen. We have health partners in Westchester Medical Center and other additional organizations. We've had a variety of satellite or pop-up vaccination locations. Some have been sponsored by the county. The majority have been sponsored by the state, but we've had them move around the county in different ways to complement these locations. And then, of course, there's a whole cohort of vaccinations being given out by local pharmacies. And those allocations come from the state, some of it come from the federal government as well, in addition to the fact that this all began with hospitals vaccinating their workforce. So in the aggregate, to have as many people vaccinated in Westchester as they did, we're very encouraged by that. And we're not having a race with other places. You know, if another part of the country is ahead of us percentage-wise, that's fine. Our mission is to vaccinate as many people as we can to protect us from the spread of the virus. And we're pleased that now the total number of vaccines given out in Westchester is about 350,000, which is very good. However, when we report statistics that come to us from the state, and they track people by zip code. So my zip code, Westchester zip code 10580, if I got vaccinated at the Javits Center or at Aqueduct or someplace upstate, that counts in the numbers that I'm reporting as to how many Westchester residents have been vaccinated. So wherever you were vaccinated in the state of New York, based on your zip code, is how we as a residential circumstance can report the degree of success. We have a Westchester County dashboard that includes some of this information. We are given information by the state on vaccinations. Those have been broken down by zip codes, so you can look at a zip code. Now, a zip code can cover a multitude of communities, so there's not necessarily a direct correlation between a particular village or a particular town, depending on what that zip code covers. But it does give you sort of a breakdown idea. And as we've said to our friends in the municipal government, if we got broken down information from the state, we would report it to everybody, so you'd have it. We have that for cases, active positives, and total cases. We do not have it for other statistics, fatalities or hospitalizations or the vaccinations, which we do get by zip code, but we do not get by municipal borders. Regardless of all of that, the numbers are coming down for infection, and the vaccination numbers are rising. That combination of information is good news, and when we report again on Monday, hopefully we'll continue to see that trend over the weekend, and for the weeks to come, that number, if it continues on the pace, will drop under 1,000 cases sometime over the next 7 days, and that will be good news. So next, I'd like to ask Irvington Mayor Brian Smith to join us. Irvington is sometimes lumped into the phrase river towns. That includes other beautiful communities, Hastings, Dobbs Ferry, Sleepy Hollow, Tarrytown, but each community has their own personality, and Irvington really has a terrific vibe. Beautiful setting, Matheson Park, looking right out on the Hudson River. And I mentioned before about the restaurants, but not just limited to that, a great library right down where the train station is. And it has a very active municipal government that provides services that are well appreciated by the people in Irvington. So I invite the mayor, Brian Smith, to tell us more about where we are in Irvington. Brian?
Thanks so much.
Thanks for being with us.
Really appreciate the invite today. And, looking back over the last 14, 15 months, we're starting as we kind of return toward normal, look back at things that, what do we want to ensure we continue to do now that we're getting through this COVID cloud. And one of them, really, the biggest one for me personally is from a kind of municipal standpoint, is strengthening our relationship, or continuing to strengthen our relationship with the county. The fact that we were on daily conference calls with you, it was really tremendous, because we feel like sometimes we're bothering the county, and I think the county feels the same way about municipalities. And there really is so much we can do to work together on things, and I think that that's something I really want to ensure that we continue to do. And the leadership of both of you has been tremendous with that. I've said it when you've joined us at our meetings, George, but back in March and February, March and April and into May of last year, there was a real dearth of leadership from the federal level and even frankly New York State level. And the county executive really filled that void for the municipalities in Irvington, in Westchester. In Irvington, we look to those calls every day as our main source of information. Things were trickling down from the state and the federal government, and George and his team were very generous with their information, and we can't thank you enough for that, and I've said that before, so it's been great. Some other things that have come out of COVID that are positive, I think expanding the outdoor seating. I think we always were worried that you're going to take up sidewalk space and parking spaces and things like that. And Irvington has a little tough in Irvington with the Main Street being so hilly. But some of the other river towns, Tarrytown and Dobbs Ferry come to mind, have really been able to expand their outdoor seating, and I think it's great. It adds a lot of vitality. We've tried to add as many seats as we can on our sidewalks. Down by the river, of course, is kind of an easy one to sell. But that's another thing that I think that's come out of this is, again, we got to work with our restaurateurs, not just coming to our building department or something when they need something and it's kind of a bureaucratic nightmare, but this is like actually working and saying, how can we help you? And I think that that's another big positive. In Irvington, we're down to kind of single digit numbers, and I know that because the county sends me the numbers, but single digit infections, which is phenomenal. We can't wait to reopen our park. We actually, you mentioned Matheson Park. We actually did a fairly major renovation, a few $1 million renovation there. We have a brand new playground. It used to be residents only. We just took that restriction off, so everyone from Westchester can now come to Matheson Park and enjoy the new playground and all the amenities there. And we always have Scenic Hudson Park as well, which is 2 waterfront parks, so we're super lucky. And in between, there's a bunch of great restaurants, which are all reopening as well. So I think there's a lot of positives going on. I do think continuing to get people to get their vaccinations is still the key. My son is 15, so he's not quite 16, so we can't wait for that Pfizer announcement to be official and let him get his vaccine. My daughter away at college, who's 18, just got hers. We're kind of living get everyone in your family vaccinated. I'm happy to report that our seniors, those that are active in our senior center, are almost 100% vaccinated. Again, the county was a big help in that. We do have a bunch of housebound seniors that you were able to send people from the Department of Health out to get them vaccinated, or their team. And it was very easy working with the county. You guys even set up days where we could bring over, say, a van when everyone was still spread out in the van over to get vaccinated, and made it very easy on our seniors. So again, we're very appreciative to that partnership. I urge everyone to come visit us in Irvington. There's as the CE said, there's a lot of great restaurants, and we look forward to hosting you. And I'd say lastly, I love the partnership with the Knicks about the vaccines. My son, who's 15, doesn't remember the Knicks ever being in the playoffs, so we're super excited. And the fact that you got such a great player like quickly to do he's so exciting, such an exciting player, and we go Knicks. I'll end on that. How's that? Thanks again for the invite. We really appreciate it.
Very good to see you.
Good to see you. Thank you so much.
Very good to see you. Brian Smith, the mayor of the village of Irvington, and you can tell your son I can barely remember when the Knicks were in the playoffs. But the upshot of it is that we're all very happy there, and we're hoping for a good baseball season over time as well, so we have something to root for with all of this. Also want to mention for Irvington, they have a Sunday farmers market. It's alternate Sundays, and aside from visiting, maybe having brunch there, It's a great farmer's market. Do walk through there. I was there a couple of weeks ago. I went to church in the community. I'm Roman Catholic. I went to Immaculate Conception, and it was lovely. So, and we encourage you to see every part of Westchester County. Wherever you live, there are other parts of the county to get to know. I've had the fortune through this particular position and others that I've held to travel, and the river towns and the Sound Shore, the southern cities and the northern parts of the county, northwestern part of the county. It's really a very beautiful county. We're very fortunate that this is our home county, and we have a lot of assets and attributes, the greatest of which are the people who live here and the talent that they bring to the table, and that is reflected in the work that you've done as well. So thank you, Brian, for being with us. We've mentioned the basic stats on COVID. Let's mention that we are returning to the career that I had before I went into public office, which is a sales and marketing executive, and we are now trying to market our vaccines. We have reached the point where the demand and the supply are about on equal footing, and we're heading to the area where we'll have more supply than demand. And that's a bit counterintuitive, because at the beginning of this process there was so much demand and so little supply that people were just beside themselves trying to get an appointment. Oh, I'll get an appointment, it's 30 days, it's 90 days from now. And great stress, because people wanted the vaccine in order to protect them from the potential of getting the disease and suffering physically. Now we're in a different place. We're trying to come up with ways to encourage you, those of you who haven't yet been vaccinated, to do that. And we do have a promotion this weekend for a Mother's Day vaccine. Now, the copy here says, nothing says Mother's Day like a vaccine. I don't know if I believe that, but I do think that you can show your mom that you love her. And you can say, Mom, when I was a little boy, you took me to get vaccinated. So come on now, for Mother's Day, let's make sure you're safe, protected. If you do have a mom who has not been vaccinated yet, this is the great opportunity. Obviously, vaccinations are free. We're opening this up particularly at the Westchester Community College. We have it at the gymnasium. It's this Saturday from 11 to 3. It's the day before Mother's Day. So in addition to giving her the gift of a vaccine, get her a real gift for Sunday. Maybe you go to the Sunday market in Irvington if this is one of those Sundays. I'm not sure if it is. But you can make an appointment by going online. We have the information available, I hope, on the screen. And if we don't, you can catch it by going onto our website. It's rather an extensive place to click onto. But you can make an appointment that way. And I think it's an important situation, certainly for those who are of a certain age, of an older, and I fall into that age category. You really do want to have a vaccine. Don't let side discussions deter you from being vaccinated. It gives you a high probability of being protected from the disease, and the potential for any difficulties are very, very low. I can tell you personally, I may have shared this already, I had the same amount of concern before I got my second shot. I had Moderna, and I heard, oh, the second shot of Moderna is going to be very difficult, and for some people it was, and for me, it wasn't a problem at all, and I was quite frankly surprised by it. So you can't always believe the worst that you hear. Go out on Mother's Day or the day before Mother's Day. We prefer you get an appointment, but you can walk in. And if you walk in with Mom and you haven't been vaccinated, by all means, make it a family matter. Both of you get vaccinated or all of you get vaccinated. And the kicker is we have some gift bags that will be available for moms as long as they last. And I'm not sure what's in the gift bag. Somebody who's much more adept at this, maybe Lisa Reyes or somebody, figured out what should go in the gift bag. Hopefully it's something Mom will like. But this is the beginning of the effort to try to promote vaccines to people who have been heretofore hesitant to do that. With that same idea in mind, we've kicked off a campaign targeted at young people with an interesting graphic, I Kicked COVID to the Curb. That campaign, which shows a youngster kicking a soccer ball, has also been put into partnership, as the mayor said, with the New York Knicks. Now, you're not going to kick a basketball, but that athletic element of it. You want to be healthy, you want to be able to participate in athletics, and you don't want to be isolated, quarantined for so many days and so forth. So this tries to make that message, and we try to do it in a creative way. Take a look at this video.
I was excited when I was able to make an appointment. Hi, I'm Ella Roth. I go to Horace Greeley High School, and I'm 18 years old.
Everyone I go to school with, we work with, they're eligible to get it now. It's not just, the elderly people. Hi, my name is Jonathan Guzman. I'm 24 years old. I go to school in John Jay in the city.
It's the beginning of the long road back to normalcy. Hi, my name is Greg Hunter. I'm 22 years old, and I go to SUNY Purchase.
I got the vaccine because of family. Hey, I'm Austin, 19, go to University of Arizona.
This is my first time returning to seeing my family in over a year. Hi there, my name is Hannah Bayless. I'm 23 years old. I just graduated the University of Vermont.
Family for me is a big part of, my life. I'm Hispanic, we're very family oriented.
I live at home with my mom and my grandmother. She's 88, so I wanted to make sure I did my part and make sure that she stayed safe as well. If you're hesitant, just do it. Be fearless, get vaccinated.
It's very easy.
It's so worth it. Please do it.
We want to thank the New York Knicks, both the players and the management, for their involvement in this PSA campaign. We also want to thank the Radio City Rockettes, who are also a participant in an earlier publicity effort to try to bring home the message, frankly, to people who can relate much better to younger folks who are in athletics or in some prominent area of involvement. And you'll see more of that as we go along. We're going to be trying to customize our message to relate to people as best as possible, to help them, feel comfortable about the idea of getting the vaccinations. We have an aggressive social media campaign that's coming up. We're going to have a youth-directed town hall on May 13th, and we'll answer questions that young peoples might have. We're partnering with schools, libraries, and other entities to try to get this information more directly into the hands of young people, and by extension to their parents. It's been a long time since I was a teenager, but I do remember how I felt in my late teens and my early 20s, and I think like most young people of that age, certainly young boys, but girls as well, you feel a bit indestructible. You're at the peak of your personal physical health, and there isn't anything you can't do, and you don't tend to worry about external things because of that youthful strength. But it's important to try to remember that whether you may be subject to the disease, and it could affect you, and it could, you could also get the disease, be asymptomatic, and then deliver the disease to other people who are more vulnerable in the world that you live in, relatives or other individuals. So it makes sense for us to try to do the things that are necessary to reach younger people and get them to understand how important it is for them to get the vaccine as well. We hope videos like this help us in the process of getting that message out. We are waiting for the U.S. Food and Drug Administration to provide information as to what's going to happen going forward for young people. As it stands today, we still have authority for Pfizer distribution to 16 and 17-year-olds. All three approved vaccines in the society, which would be Pfizer, Moderna, and Johnson & Johnson, are available for people 18 years of age and older. And of course, we try to make decisions as to how we allocate the different types of vaccines where they may do the most good. When we have homebound vaccinations, we lean on using our Johnson & Johnson product because that is a one-shot administration, much easier for us if we're going to somebody's home or out in a residential context. Moderna is generally the vaccine that we give out to the greater degree because it's easier to store. Pfizer has to be stored at super cold levels and a little more complicated, but we have that at the county center. All of these things are available. There's an online place to check it out, the Vaccine Finder tool, and you can call the Westchester County Department of Health at 995-7425 for any information about all of these different things. The health department has been the critical point of contact between the county government and all entities relating to this. We ask you to call the health department. You find information on the website. It's the health department that works with all kinds of entities to help them make sure that they are operating a safe way and all of the sanitization efforts and so forth. But they're not the only part of county government that's been very engaged in this. And I want to give a shout out to our Department of Emergency Services for their work. They have served as the clearinghouse over the course of this pandemic for getting PPE, personal protective equipment, available from state and other resources and then redistributed across Westchester to those groups that are in need. They may be healthcare facilities, they may be municipal governments, they may be any combination of profit, nonprofit organizations to help them. And as we go into the summer season, we're going to try to make sure that we provide that for community recreational programs, for those nonprofits and small businesses, things that have summer camp purposes. And once again, the county government is performing a regional function. We work in harmony, in cooperation with the local governments, with our ability to reach the state government as one of a number of counties, and then turn around and being able to disseminate that out locally. And whether it's hand sanitizing product or masks or whatever it is, we're trying very hard to make a good comparison there. In some other news, somewhat COVID related, New York State has extended the state ban on residential evictions until later this summer. It was scheduled originally to expire right about now. I believe they've sent the date until August 31st, and we'll see whether or not that moratorium deadline changes. That involves both rental evictions and foreclosures, which is usually foreclosing a mortgage. So it's a home ownership scenario where the individual has the same problem that they have where they're a rental tenant, which is the inability to make monthly payments on either a mortgage or monthly payments to stay in a rental setting. The governor announced the moratorium originally back in March of last year to make sure that no tenant was evicted during the height of the pandemic. We've gone through a long period of time now, and it's a bit difficult because what we're facing, frankly, is an accumulation of owed rent or owed payments that have destabilized those people that own these facilities. And many of the landlords are small business owners. They have buildings with a half a dozen residents, and they find that now they can't make payments on taxes. They can't buy oil, make improvements, the things necessary as well. So it is a state matter. The county does have a role to play. We are going to be prepared to be assisting with legal assistance for those that face eviction when the time comes. Through our Department of Social Services and certain programs, we will have some resources at the ready to handle a certain amount of back rent, and then some of the money that's come down from the federal government is earmarked for that purpose, and we will try to be helpful as these evictions come to pass. But for right now, that whole scenario has been pushed off to the end of the summer, and we'll be making plans to be helpful, try to deal with that as we complete the summertime period. The state has made a number of changes in their regulations for capacities. Throughout the whole pandemic, hopefully you understand that the state government has made the key policy decisions, not just in New York, but everywhere across the country. And local governments, mayors and county executives and town supervisors and so forth, have been tasked with implementing them in our backyards. We have our police forces and in our case, our health department and other entities in government to take this policy that's being created, and generally it's been created by the governor. The state legislature started to take back some of that power, but in general it's been the gubernatorial executive orders that have come down. There's a host of changes that have been made. I'm going to ask Ken to run through them. For those of you of a certain age, if you remember a comedian who appeared in the 1960s by the name of Red Skelton, most of you don't remember him, he would tell jokes that didn't go over in a skit, and he'd say, "I just tell the jokes, I don't explain them." So here, we can tell you what policies have come down so you're aware of them. The rationale, obviously, is by those that created the policies. Our job is to administer these policies, so Ken will tell you what the policies are, and we'll figure out another way to explain them if you have questions about them. Ken.
Thanks, George. And as the county executive has pointed out from day one, the changes happen at the state level, and our county departments implement them as the best as we can. So there's been a ton of changes, and really starting with the big date that effective May 19th, most businesses and most of their capacities are going to be expanded. They're going to be the restrictions that were in place for the time of the pandemic are mostly going to be removed. There are very specific instances where they are not, but it also talks about the maximum number of patrons. Certainly, as Mayor Smith talked about a few minutes ago, in Irvington and all around the municipalities, the outdoor dining, indoor dining capacities, and those things have changed. Houses of worship, gyms, fitness centers, salons, amusement parks, family entertainment, movie theaters, certainly all of those things have been modified. All of them still require, at the bottom line, still to have a mask. So we want to make sure to go through all of those, and we'll start with the outdoor social gathering limit. So the outdoor social gathering limit is going to increase from 200 people to 500 people on May 10th. So in your backyard, you can go up to 500 people in the backyard for outdoor social gathering limits. You still need to make sure to keep that social distance, the 6-foot areas between people that are not family members. The indoor social gathering limit is going to increase to 250 people starting on May 19th. So we have large scale indoor event venues are going to be able to operate at 30% capacity starting May 19th. So for the Knicks fans, like the mayor's son, they're going to be able to go to those particular places like the Garden. The outdoor facilities have areas in the New York Yankees, New York Mets, that the county executive and many folks are following. At this particular point in time, they're going to have specific sections for people that are fully vaccinated, 2 weeks after your second shot if you're Moderna or Pfizer, 1 week after the Johnson & Johnson, 2 weeks after the one-shot Johnson & Johnson vaccine, where you will be able to sit 100% in a section for just vaccinated individuals. They also had a great promotion, taking advantage of the sales and marketing skills the county executive pointed out, but they have a promotion in the city that you can get vaccinated at the game and you would get a free ticket for the Mets or the Yankees, your particular choice for a future game. In New York City, the subways are going to resume 24 hours of service a day beginning May 17th. And in New York City, if you're going to dine in New York City, they're going to go up to 75% capacity. That happened on May 7th. You know what? The hair salons, barbershops, and other personal care services are up to, at this particular point in time, May 7th, 75% capacity. Some of us need a new trim for Mother's Day that we'll hope to get that done. Again, May 7th, 75% capacity. The 12 a.m. food and beverage curfew will be lifted for outdoor dining beginning May 7th. So if you go to River City Grill, enjoying those folks that are doing from May 10th to May 23rd, the Hudson Valley Restaurant Week things, and hopefully people will take advantage of those, they'll be able to be past the 12 o'clock a.m. food and beverage curfew. So whatever that curfew is in your local municipality, that is the one that will be in place and beginning May 7th, and that's the outdoor dining areas. For indoor dining, that's going to be lifted at the end of the month. There's a 1 a.m. curfew for catered events right now where you had to have proved a proof of vaccination status or a recent negative COVID test result. That's going to be lifted in its entirety on May 17th, with the curfew for all catered events to be lifted on May 31st. So as the vaccinations, as the county executive pointed out initially, continue to happen, the number of vaccinated people continue to improve. Many, many, many more items are going to be able to be done back to the new normal, back to most of the things that we were working out before. One of the other things that happened was the CDC and New York State allowed for you to be maskless outdoors if you were vaccinated, past the 2-week time frame, meaning fully vaccinated, and walk around as long as you're not in a big group. And again, a big group can be 3 or 4 people, depending on what your feeling is. But again, it's given us more opportunity, more freedom to move about and be able to be back towards normal, because there's a bunch of folks out there that have been clamoring and really frustrated about not being able to do all the things they want to do, hug their grandchildren, hug their friends and neighbors, be able to talk and just have a regular old conversation over whatever cold beverage you choose to do. Offices can increase capacity to 75% beginning May 15th. So on May 15th, 75% capacity. Many businesses and certainly the county and all the municipalities have been open with their staff, trying to make sure to protect all of them. But everyone's offices can increase capacity to 75% beginning May 15th. These are just some of the changes that happen. They continue to happen. As soon as we have that information, we'll make sure to pass it on to you. Thanks a lot, George.
Thank you very much, Ken. And of course, as you can see, when the state puts out those kind of guidelines, we all have to be sure to enforce them. The enforcement tool comes from local police, county police, and even more so village, town, and city police. And all of these things are such that we want to try to enforce it for compliance, not for punishment. So hopefully people are aware of this. The business operators will operate within the parameters that's been structured by state law. And if we continue to do the right thing and we continue to see the benefit of the vaccination program, then we're going to see the infections drop and we're going to get back to normal. That's really what our key issue is. So I just want to mention one other thing, and then we'll see if we have any questions. We may not today, but there's always that opportunity. We've recently come to closure on our recent contract with the Civil Service Employee Association, CSEA. That's Westchester County's largest union, well over 60% of our workforce. Members of CSEA. When I came into office, January of 2018, they had gone without a contract for 7 years. We had some negotiations. It was not easy negotiations because there were certain concessions that had to be made by the union, and the county had to make certain guarantees as well. And they made certain efforts to sacrifice. We certainly made certain efforts to sacrifice. We were able to fund closing that gap and then go forward. And now what we've done for the contract that was scheduled to expire at the end of 2021, extended that for a year until December of 2022 at favorable terms for both sides, a workable employee increase that we can afford, and still continue to deliver lower taxes as we've cut taxes the last 2 years. We're hopeful that we may be able to do the same this year, but we don't know that yet. But having labor predictability is a very important part of it. We are still working with the other unions that have either contracts that will expire or have expired already, the Teamsters, nurses, correctional officials, and Police Benefit Association individuals. We have great respect for our workforce. We want to try to negotiate fair contracts and contracts that they can live under, but at the same time that the people of Westchester can afford. And I think it's important to recognize that we want to be fair in all of our dealings, whether we deal with government officials, whether we deal with the employees in our workforce, and the members of the public when they come and interact with county government. So we're pleased that that issue is behind us. There'll be other issues to talk about in future updates. We will be back at 2 o'clock on Monday to give the next update. And again, as we do this in 3 to 4 day intervals, we hope for the best possible result. I gather by checking with Catherine Chaffee, we have no press questions. But if there is anybody from the press that wishes to ask us any questions, feel free to reach out to us, 995-2932. Catherine Chaffee, our Director of Communications, and we'll be happy to address them individually for any issues that happen. Just want to close on a personal note. Today is Thursday, May 6th. And May 6th is an important date in my family's experience. I would say for the public at large, arguably one of the greatest baseball players ever holds his birthday today. Willie Mays turns 90 years of age today, and he spent the very end of his career with the New York Mets, but he had a fabulous career with the New York and San Francisco Giants, and was a big fan favorite from my mother's side of the family, who were Giant fans. My father respected him, but not as much. When you're a Dodger fan, you're on the other side of the equation. And most of the folks in Westchester County tend to be Yankee fans. But Willie Mays, a great player, celebrating his 90th birthday today. Why do I highlight that one birthday out of the total? Because it's also the day which would have been my father's birthday were he alive, and he would have reached the tender age of 110 if he were alive today. We lost him back in 1994 when he was 82 on the cusp of 83. But he always made a point of pointing out to me when I was growing up that he and Willie Mays had the same birthday, and he took some pride for that. I told him that I had the same birthday as Lou Burdette, who was a pitcher back in the 50s. That didn't seem to cut as much importance to him. But it did have me reflect on my father, who was a working man, worked with his hands all of his life, and he had the hands of a working man. I commented on this in my Facebook post, and have the hands of a person who spent his life in sales, marketing, and public office. Not the same look. But I look back now over the years with a greater appreciation of what my parents were able to accomplish as blue-collar workers. My dad was a maintenance man, head of maintenance, Beach Point Club, and my mother was a factory worker, worked in a number of factories in and around the Mount Vernon area. And they were, by all standards, blue-collar individuals. They both had to drop out of school during the Depression at different grade levels, never finished high school, took great satisfaction when my younger sister and I graduated high school, much less when we both went on to college. And, I try to think back on how they felt and the sacrifices they made, not just during the Depression, of course, during the war years. My father was overseas. My mother was working in a factory. That's where she began her factory work during World War II. And then, of course, they met after the war. And, all the baby boom kids that are now aging were the product of those people meeting up and starting families after the war was over. And how in a very little apartment, a very small apartment on the south side of Mount Vernon, I was the little baby in the family between my mother and father. And what they hoped that would be accomplished by their child. And of course, I'm very fortunate to have had a good fortune in my life. I wish my parents were still alive so they could see some of that, because this is the fruit of their sacrifice. But it's not a story of me as an individual, it's a story of all of us. It's a story that what we care about is more than just the short term, we care about the long term. And if we love our parents and we love our children, grandchildren, and our siblings, we share something in common. And it doesn't matter that we have different religious traditions. It doesn't matter that we're of different genders or gender identities or different colors of our skin. We share a certain common humanity. And this pandemic has reminded all of us that we share that common reality. When we see people in India that are suffering and dying, they're no different than us. The infrastructure of their country is different from the infrastructure of our country. And just as I consider myself a very lucky person over the course of my life, I got to go to college. I was a commuter and I worked while I was in college, but I got to go to college. And my parents didn't have that advantage. And here in America, we have certain advantages. The structure of the government and the society that we created, not a perfect society, but we're able to deal with certain issues in a way that when you look in Africa and you look at parts of Asia and South America, they don't have those same structural advantages. The children born are no intrinsically different than the children born here in the United States in a certain setting. But the world they come into, the pressures, the lack of economics, all of those things go into play. And when a pandemic comes across the world, it's on every continent. It's even in Antarctica. It's on every continent of this world. And it should bind us together as people. We have a very divisive moment in the society. We have a moment in the society where it is more fashionable to call names to the people you disagree with, to follow the path that one party makes. And while we have our beliefs, and I have my beliefs too, you know, my dad was an FDR Democrat, and I grew up in that family, and I adhere to many of the things that came from that experience as a kid. But I also understand that our respect for each other as Americans has to supersede the things that we disagree with, to understand that what we have in common is greater than what divides us. And we have to respect each other enough to work through those disagreements, so that if a person holds different political beliefs than I do, we at least respect each other enough and we try to find common ground. We don't immediately assume you're the enemy and my job here is to defeat you and minimize you in whatever way possible, and they take the same tack. That leads us in a direction that we had once before in this country, and it led to 650,000 deaths in a civil war that took 4 years of blood spilled. In this current age, with more modern weapons of destruction, if we continue on a path to destruction, you couldn't even calculate what would happen in that. But when I think of my father, and I think that he would have had a sweep of 110 years, even 110 years comes and goes. No matter how long a period of time, the America of 1911 that he was born into is very different from the America of 2021. Our challenge today is to try to figure out how to handle today, our problems today, but to keep an eye on tomorrow. Because the little child that's in the same little bedroom that I grew up in on South 14th Avenue, there's a little child in that bedroom today, and they hopefully will have a 60, 70, 80-year span of life going forward. And we cannot put today's immediate needs, today's immediate prejudices, today's immediate aspirations as the only thing that's important to us. And as we look at how we structure these policies and we try to convince people, we want you to have a vaccine, we want you to be healthy, we don't want to argue with you over ideology. We want to make sure that we get through this pandemic. And we don't want this pandemic to linger on and continue to hurt us economically. We don't want to argue about these things. We want to solve these things. That's the principle underneath it. My father was not a man of formal education, but he read extensively. And as I was a young man, he's, as I said, I think in my post today, he was pretty much always on broadcast, and he expected me to always be on receive. You know, he was talking, I don't think it was much different with Ken and his dad, who was a NYPD police sergeant. These were men of a generation that, had some wisdom to impart, and their mission was to impart it to their sons so that someday when they weren't around and we became the adults, that we could be good, solid, functioning adults. And so I take great comfort from the memory of my father and my mother too. And I hope that that our better angels will be what guides us as we make these policies going forward. We have our differences. In democracy, we have every right to free speech, and we have every right to express those differences, and we have every right to advocate for what we want. But in the bigger picture, we need to have the unity we need in order to fight this issue and the others that are at hand. And remember that those people in India, they're our brothers and sisters too. They are just as much a part of the overall world that we live in. And if you're a person of faith, as I happen to be, that there is some greater force of good above all of us that we have to be thoughtful about. So we do our secular job. We treat sewerage, and we run a bus system, and we run a jail, because jails unfortunately are necessary in this society, but we also run parks where you can run and play, because those too are valuable in society. We do our job on a secular level, but we never forget some of these greater things, and particularly on the day where Stan would have been 110 years old. I just want to make sure that the world, who may not have known him, know at least that his son has never forgotten him. So thank you for watching. Have a wonderful day.